A letter from a group calling itself the Nova Scotia Alcohol Policy Coalition is asking the province to consider the negative effects of making alcohol more accessible in the province. No decision has been made yet, but several sources say Nova Scotia is expected to become the latest province to allow alcohol to be sold in convenience stores. The letter, which is signed by doctors, academics, and various advocates, says alcohol is responsible for hundreds of deaths every year in Nova Scotia and thousands of visits to hospitals. They say putting alcohol in convenience stores without guardrails would go against the province's mandate to fix the healthcare system, so proper consultation with public health is essential.
There is no doubt that increased access to alcohol is going to increase healthcare costs. It's going to increase demand in emergency rooms that are already overburdened and result in a lot more harm to Nova Scotians.
By making alcohol more accessible in Nova Scotia, the coalition argues the province risks compounding existing harms, such as intimate partner violence, which the province declared an epidemic last year.
So if you are concerned about intimate partner violence in Nova Scotia, you must be concerned about increasing access to alcohol where there are no guardrails and where we haven't done a full health and mental health impact assessment.
CBC News asked the Convenience Industry Council of Canada for an interview, but they declined. In a statement, a spokesperson says the organization has been advocating for alcohol to be sold in convenience stores in Nova Scotia and across Atlantic Canada. The statement said their members have a stellar track record in selling age-restricted products, and they look forward to Nova Scotia joining other provinces such as Ontario, Quebec, and Newfoundland and Labrador in having alcohol in stores. The province declined to be interviewed for this story, but the latest report card from an initiative called the Canadian Alcohol Policy Evaluation gave Nova Scotia a failing grade when it came to its current alcohol policies, which is just another reason the coalition says public health needs to be consulted if alcohol is going to be easier to access. Josh Hoffman, CBC News, Halifax.